Last year alone, thousands of older adults ended up with the wrong diagnosis, not because the doctor didn't care, but because of how the conversation went in the exam room. In this video, I'll expose 8 everyday speaking habits that can quietly sabotage your medical care. Whether you're 65 or 85, these subtle missteps can mean the difference between catching a health problem early and letting it spiral into a crisis. We'll break down exactly what they are and what to say instead, so you can walk out of every appointment confident and in control. Mistake number 8 is the one even the most proactive patients make, and fixing it could instantly improve the quality of your treatment. Stay with me because you might recognize yourself in more than one of these. I'm Dr. Eli Morgan. After 3 decades working with patients across 5 countries, I've seen how the right words can speed up a diagnosis and the wrong ones can delay it for months. Let's get started. Mistake number 1, being too indirect about what's wrong. Some seniors begin their appointment with small talk or vague hints, hoping the doctor will read between the lines. The problem? Medical visits are short, and in those first 2 minutes, your words heavily influence how seriously your case is handled. I once had a patient, Mr. Alvarez, who started with, "I'm feeling a bit off lately, but it's nothing urgent." We almost spent the visit discussing minor issues, until I asked directly about his chest pain, which turned out to be an early warning of heart trouble. If I hadn't probed, that detail could have been missed entirely. Here's what works better. Open with your main concern in one strong sentence. For example, "I'm here because I've had chest pressure for 3 days and it's getting worse." Follow it with when it began, how it feels, and what triggers it. Be polite, yes, but be crystal clear and urgent about your main reason for being there. It's not pushy. It's smart healthcare. Mistake number 2, describing symptoms without useful details. Saying "I feel dizzy" or "my back hurts" gives your doctor almost nothing to work with. Without specifics, they have to guess which tests to run, and guessing wastes precious time. One gentleman, Mr. Tanaka, told me only that he'd been lightheaded. After several minutes of questioning, we learned it happened after standing up quickly in the morning, lasted under a minute, and improved with water. That pointed us toward a simple blood pressure issue instead of more invasive tests. Before your appointment, jot down 4 key points. What exactly happens? Sharp, dull, spinning, throbbing, etc. When it started and how often it occurs. Triggers. What makes it better or worse? Impact. How it affects your daily life. You don't need fancy language. Short, factual notes are enough. Think of it like giving a mechanic clear info before they open the hood. The better the description, the faster your care will be on target. Mistake number 3, ignoring small changes in your body. Many older adults dismiss new symptoms as just aging. The danger? Minor changes can be early warning signs of something serious. I remember Mrs. Parker, who mentioned at the end of a routine checkup that her left hand had been weak for a week. She assumed it was arthritis. In reality, she was experiencing a mini stroke, and delaying attention could have led to permanent disability. Pay attention to sudden weakness, new vision problems, shortness of breath, swelling in your legs, or unexplained weight change. These aren't normal parts of getting older. They're your body's distress signals. If something feels different and lasts more than a day or 2, or appears suddenly and severely, bring it up immediately, even if you have another reason for the appointment. You know your body better than anyone. Trust that instinct. When in doubt, speak up. It's far easier to rule out a big problem than to reverse damage that's already done. Mistake number 4, downplaying to avoid. Making a fuss. Some seniors soften their language by saying it's just a little discomfort when it's really pain that wakes them at night because they fear being labeled dramatic. This instinct can backfire badly. One man, Mr. Lawrence, told me his hip was a bit sore. After some digging, he admitted he couldn't walk to the mailbox without stopping. That single piece of information changed my entire approach and revealed advanced joint damage that needed urgent attention. Minimizing symptoms makes it harder for your doctor to prioritize the right tests or treatments. Instead of rating your pain or discomfort low to seem tough, describe exactly how it affects your daily function. I can't carry groceries without resting. Or, I have to hold the wall to get to the bathroom at night. Being honest about the severity doesn't make you a burden. It gives your medical team the chance to actually help you. Mistake number 5, letting someone else tell your story. It's fine to bring a spouse, child, or friend to an appointment, but problems start when they do all the talking while you sit quietly. Even with good intentions, they might leave out crucial details or describe your symptoms in a way that's slightly off. I once saw a couple where the wife explained her husband's cough as seasonal allergies. When I asked him directly, he revealed coughing up blood, a symptom his wife hadn't noticed. That changed the urgency from mild to critical. If someone accompanies you, agree beforehand. They can add details, but you speak first. If they jump in too much, it's okay to say, "I'd like to explain that myself." Remember, you're the only one who truly knows what you feel. Your voice should lead the conversation. Others are there to support, not replace it. Mistake number 6, leaving without fully understanding. Some patients nod politely during an explanation, even when they don't understand the medical terms. They leave with half the picture. And that can lead to missed follow-ups, wrong medication use, or unnecessary anxiety. One patient, Mr. Singh, left thinking his benign growth was cancer because he didn't ask for clarification. He spent a week in needless fear until a nurse called to explain. Before you walk out, make sure you can answer these 4 questions. What exactly is my diagnosis or main finding? How serious is it? What are my treatment or monitoring options? What should I watch for at home? If the answer isn't clear, say, "Could you explain that another way?" A good clinician will respect your persistence. You're not slowing them down. You're preventing mistakes. Leaving informed is as important as showing up. Don't trade politeness for your peace of mind. Mistake number 7, forgetting to bring or request written notes. Even the sharpest memory can fail after a dense medical conversation. Without written instructions, it's easy to mix up medication timing, forget follow-up steps, or lose track of test results. I recall Mr. Gomez, who left with verbal instructions for 3 new medications. By the time he got home, he wasn't sure which pill to take first, and skipped one entirely for a week. Bring a small notebook or use your phone to jot down key points as the doctor speaks. Better yet, ask, "Could you write that down for me?" Many clinics can also print a summary before you leave. Keep these notes in one place so you can reference them at your next visit. Clear, written instructions mean fewer mistakes, better follow-through, and less stress later. Your health plan should never depend on how much you can remember in the car ride home. Mistake number 8, skipping the next step. Question: too many seniors leave an appointment without knowing exactly what happens next. That gap can lead to missed follow-ups, untreated conditions, or months of uncertainty. One woman, Mrs. Daniels, had an abnormal heart rhythm found on a routine check. She assumed the clinic would call her if it was serious, but no one did. 6 months later, she landed in the hospital with worsening symptoms that could have been prevented. At the end of every visit, ask, "What is the next step and when will it happen?" That could mean a test, a referral, a medication change, or simply monitoring for changes. Also confirm who will contact you and how long you should wait before following up if you hear nothing. Clear next steps create accountability on both sides and ensure you're not left wondering or falling through the cracks. Conclusion: we've covered 8 speaking habits that can quietly undermine your medical care. From being too indirect to leaving without a clear next step. You don't need medical training to fix them. You just need to be prepared, specific, and willing to speak up. Your health is not a favor someone does for you. It's your right, and you have more influence in the exam room than you may think. If you found even one tip today that you'll use at your next appointment, take a second to like this video so more seniors can see it. Subscribe for more practical, no-nonsense advice to help you stay healthy and independent. And share this with a friend or family member who could use a little more confidence at the doctor's office. I'm Dr. Eli Morgan. Until next time, speak clearly, ask boldly, and take charge of your care.